Councilmember Benedict,
Present.
Councilmember Glover, Councilmember Hall, Councilmember Porterfield,
Present.
Councilmember Pulley,
Present.
and Councilmember Welsh.
Present.
Thank you all so very much. We have a motion pursuant to the Governor Lee's Executive Order number 16 regarding electronic meetings as extended by Executive Orders number 34 and 51. I make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council and that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak. Is there a second?
Second.
Second.
All in favor?
Aye.
Aye.
Thank you very much. So we're going to go through, I'm very technically not savvy. And I always say I'm going to do this before the meeting, and I don't know where my time goes. But I hope you all have your agendas before you. We've got quite a few resolutions, but they are not going to take very long. And I appreciate having Mr. Sharp and Dr. Cruz and Mr. Cox all here. If there are any questions, is there anyone else who's here that I may have missed? Okay, thank you. We will go ahead and begin with Resolution 2020-402, Mendez, Hurt, and others. Approves a grant contract between the Metro government and the Equity Alliance to provide a community needs assessment related to federal coronavirus relief funding. So I'm sure we all are very familiar with this grant, the COVID-19 funds that are coming in for $121 million. And the Equity Alliance has been chosen to make sure that the funds are going to be dispersed objectively throughout the city, and particularly making sure that the North Nashville community and the communities of color are included, because we know historically they have not. Is there a motion?
So moved.
So moved. Second.
Thank you. Any more discussions regarding it? If not, then all in favor say aye.
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 Aye. There any opposed? Okay, thank you very much. The next resolution is 2020-407, Mendez, Hurt, and others, appropriates grant funds from the Tennessee Department of Human Services to the Metro Action Commission to address community needs resulting from the COVID-19 pandemic. Is there a motion?
So moved.
Is there a second?
Second.
Thank you very much. Dr. Kroom, would you like to give us a brief comment in regards to the grant funds that you're receiving?
Yes, Marvin Cox is on. He's going to respond. I'm just here for backup in case his system wasn't working.
Okay, thank you. Mr. Cox?
I'm not sure that Mr. Cox has an audio connection with his computer.
Okay, that's fine. Then I will go ahead and explain. So these are dollars that are designed to assist with rent and mortgage. Currently, under the normal dollars that we receive through the state, the maximum is 125% of poverty. The COVID dollars allow us to serve individuals in our community up to 200% of poverty. So that's the purpose for these funds.
Okay, are there any questions for Dr. Kroom? And thank you, Councilman Pulley, for that observation. And Dr. Crum, the next 2 or 3 resolutions will be specifically for Metro Action, so please stay aware. Are there any more concerns or discussions regarding the 407? There being none, all in favor?
Aye.
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 Any opposed? Great, thank you very much. Resolution RS 2024-16, Hurt, Welsh, and others, approves a contract between Metro Social Services Commission and the University of Tennessee College of Social Work to provide clinical experience opportunities for its students. Have a motion, please.
Move.
Second.
Thank you. Dr. Crooms.
Just as a reminder, this is for Metro Social Services, not for Metro Action Commission.
Oh my God, I do that every time. I do that every time. I'm sorry.
No
Metro
problem.
Social Services. Do we have anyone on there on the meeting from Social Services? If not, then I can talk on this because I know that this is a grant and contract that's been in place for years, and they do provide clinical experiences for those students that are in the University of Tennessee Social Work program that's operated at Tennessee State University. And I think that it's a great program. It's been there for quite some time, and this grant just allows them to be able to continue providing those services. Any questions? All in favor?
Aye.
Aye.
I need one more.
Aye.
All in favor? Any opposed? Okay, thank you very much. Resolutions RS 2024-17. This is a grant, approves an Amendment 5 to a grant from the Greater Nashville Regional Council to the Metro Social Services Commission to provide meals that meet RDA nutritional guidelines and transportation services to eligible seniors and handicapped residents. May I have a motion?
Move. Second.
Thank you very much. So this is basically the Meals on Wheels program that they have that they get this grant for every year. It's very successful. I know that Carol Wilson has attended meetings, and anytime we ask for demographic information about where they're going and how many in each section of the city, she's been very helpful in making sure that we get that very timely. Are there any questions in regards to this grant? There being none, all in favor, say aye.
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 Any opposed? Okay, thank you very much. Resolution 2024-18, Mendez, Hurt, and others approves a contract for services between the Metro Board of Health and Neighborhood Health, Inc. to provide homeless individuals with medical services at 2 or more clinics in or near downtown Nashville. I have a motion.
Move.
Second.
Thank you. Mr. Sharp, do you want to say anything in regards to this grant contract?
Thank you, Madam Chairman. That's a longstanding, that's the downtown clinic that we fund a portion of. It's in the charter that the health department will provide homelessness medical services, which we did as a department for a long time. And then for the last, I'm not sure how long, it's been a while, we contracted with neighborhood health for that service.
Okay, thank you. Are there any questions for Mr. Sharp? There being none, let's move with a vote. All in favor?
Aye.
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 All in favor?
Aye.
Thank you. Any opposed? Thank you very much. Resolution 2024-419 approves Amendment 1 to a grant from the National Association of County and City Health Officials to the Metro Board of Health to participate in the Sexually Transmitted Infections Express Data Collaborative to further establish the evidence base for express services and support quality improvement of established express models. May I have a motion?
So moved.
Second.
Thank you very much. Mr. Sharp.
That is an extension of an existing program, and that's about all I know. Honestly, what they do, it's a collaborative look at HIV is what I know about it much.
Okay, well, if it is for HIV, then I need to recuse myself from the vote. But all in favor? Would you please, are there any other questions? I'm sorry, before that.
Chairman, I misspoke. That is sexually transmitted diseases more generally. It's not specific to HIV. I beg your pardon.
Right, thank you. I wasn't sure, but I wanted to make sure that I did do the right thing. So all in favor, say aye. Aye.
Aye.
Aye.
Thank you. Any opposed? There being none, we'll move to the next resolution of 2024-20. Mendez, Hurd, and others. Approves Amendment 3 to a grant from the U.S. Department of Health and Human Services to the Metro Board of Health to enhance access to comprehensive continuum of high-quality community-based care for low-income individuals and families with HIV disease. May I have a motion?
So moved.
Second? Thank you. Mr. Sharp, I know you basically just indicated, is it anything else you'd like to say in regards to that?
No, ma'am. That's a very small addition to the Ryan White grant, I believe.
Okay. And this one, I do have to recuse myself from the vote. So all in favor, say aye.
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 Do I need two more?
Aye.
Aye.
Thank you very much. The next resolution is Resolution 2024-1. Mendez, Hurd, and others accepts a grant from the Tennessee Department of Health to the Metro Board of Health to provide HIV/AIDS core medical services and early intervention services. Is there a motion?
So moved.
Second.
Thank you. Mr. Sharp, this is Ryan White.
That is a state HIV grant, I believe, ma'am. And is a small amount, additional amount to the state HIV program.
Okay. This grant, I too have to recuse myself. So all in favor, please say aye.
Aye.
Any opposes? Thank you very much. Resolution 2024-2, Mendez, Hurd, Welsh, approves a contract between the Metro Board of Health and the Tennessee Department of Health for arbovirus testing of mosquito samples for West Nile virus. May I have a motion?
Move.
So moved.
Second.
Thank you very much. Mr. Sharp.
We were afraid that we didn't have enough viruses to worry about, so we want to look for West Nile and mosquitoes.
Okay,
We do that regularly. That's a standard program.
right. Thank you very much. Any more questions or discussion? There being none, all in favor say aye. Aye.
Aye.
Aye.
Aye.
Any opposed? Thank you. Resolution 2024-23, Hurt, Welsh, and Stiles approves a business associate agreement between the Metro Board of Health and RX Staff, LLC, to provide safeguards to prevent the use or disclosure of protected health information. Mr. Sharp.
Madam Chairman, we are in a position now where we're having to hire a temporary pharmacist and some temporary pharmacy techs. And because they are not our employees, we make sure that under this arrangement that they abide by HIPAA while they're working for us.
Right. Any more questions for Mr. Sharp? Thank you very much. All in favor say aye. Aye.
Aye.
Aye.
Aye.
Any
Aye.
opposed? Thank you. RS 2024-24, Hurt Welsh approves a license agreement between greatergood.org and the Metro Board of Health to create, exchange, and/or use certain media materials in a collaborative process relating to supplies for shelters and Antinol joint supplement. May I have a motion?
So moved.
Second.
Thank you. Mr. Sharp.
Madam Chairman, you know about as much about that one as I do, having read that. It sounds like somebody's trying to give us some medicine for the animal shelter.
Yes. Well, thank you. Are there any questions or discussions? There being none, all in favor say aye. Aye.
Aye.
One more.
Aye.
Thank you very much. Any opposed? There being none, we move to the next resolution, which is our last resolution for the day, Resolution 2024-25, Hurt, Allen, and others, approves Amendment 1 to a Healthy Built Environment Grant from the Tennessee Department of Health to the Metro Board of Health to purchase and plant trees in conjunction with the Nashville project to promote and support healthier living environments. May I have a motion?
So moved.
There a second?
Second.
Thank you very much. Mr. Sharp, please.
Thank you, Madam Chairman. So back in normal times, we used to operate a thing called the Health in All Policies Group, which is a collaboration among several different multiple metro departments to try to inculcate the idea that a lot of things that they do have health implications. The libraries are there, Public Works is there, parks are there. The police are there. There's a bunch of different departments that participate. That grant came to us. I think it's $20,000, maybe something like that. And we put it to the Health and All Policies Group and said, what would be the best way to just collectively figure out how to spend this money? And they decided that the Route Nashville tree planting was a good project. And so that's where that money is allocated.
Okay, thank you very much. Are there any more discussions or questions for Mr. Sharp? There being none, all in favor say aye. Aye.
Aye.
Any opposed? Thank you very much, Mr. Sharp and Dr. Kroon, for participating in the meeting today. That ends our agenda. Yes, Councilwoman Benedict, you have a question?
Thank you, Chair. I just wanted to call out a resolution that I believe will be on consent, but I know that you were a big part of getting in place. I'm carrying it because I believe you have something else up tonight, but I just wanted to make sure that that the committee is aware of RS 2024-32, which just further supports the health department's and the chief medical director's order mandating cloth face coverings or masks. As we know throughout the world, this is one of the ways that is perhaps the most effective in addition to social distancing and washing your hands frequently. But wearing masks really is what's going to make the difference and allow us to get back to work, back to business more quickly and eradicate this virus, or at least lessen it as much as possible. So I appreciate that I get to be a part of that, and I appreciate your leadership on that, Chair. And I also hope that everyone today is supporting that. It'll be up in the Rules Committee at 5:30 because it is a late filed resolution. Thank you.
Well, thank you very much, Council Lady Benedict, for sharing that information, and we certainly appreciate it and do support it. Are there any questions, discussions as regards to anything that we've passed this evening? If not, then we are adjourned. Thank you all again for participating.
Thank you.
Thank you, Madam Chairman.